If you want your fibroids gone and still want to preserve your womb, then this video is for you, because the procedure I'm going to talk about will help you take care of the fibroid and also preserve your womb. At the end of the video, I want you to have a discussion with your doctor and let's come to a conclusion that this is the procedure we are going to use or the other ones. Let me explain myomectomy to you and what to expect when you are going for a myomectomy. So in simple terms, myomectomy is the removal of the fibroid nodules from the uterus whilst you are still preserving the uterus or the womb. And this has made it the must go-to option for a lot of women who really want to preserve their uterus. So there are three main approaches. Let me walk you through this approach and then you will find out one of the approaches might be what you actually need. The first one is hysteroscopic myomectomy. This is usually used for submucosal fibroids. These submucosal fibroids, if you watch the other videos, I've told you that they lie or they bulge into the cavity of the uterus or they bulge into the womb. So in this procedure, there's no external cut. The cut where you can see that there's a cut on the abdomen, no, there's no cut. They go through the cervix, and through the cervix there's a camera that sees wherever the fibroid is, and then it goes to cut them, plug them, and then take them out of the womb. This one has a very fast recovery, so it is the fastest recovery. Now go back, check on your scan and see which type of fibroid you have. The second one, it's called laparoscopic or robotic myomectomy. So just as the name goes, this is the type that they create small holes on the abdomen or the abdominal wall, and then they go in, they look for the fibroid, and then they cut them into pieces and suction it out. Those incisions are called the keyhole incisions. So in this procedure, they don't need to go inside the uterus. With fibroids that surround or around the uterus, they can able to take them out. Example, the subserosal fibroids. Now, the last one is what we call open abdominal myomectomy. In this procedure, that is where we make a large incision and then bring the uterus out sometimes, or even perform the procedure inside. So in this procedure, intramural, subserosal, submucosal, all the types of fibroids can be treated with this procedure as well, especially if you have multiple fibroids. Recovery differs from the various types of approaches, from 4 days of recovery for the hysteroscopic and those laparoscopic approaches, all the way up to 6 weeks for the open abdominal myomectomy. Now, this is a very important point I want you to keep. The occurrences or the rate of occurrences in fibroid is very high. One should know about this. All these treatment procedures or approaches does not mean you won't get fibroid again. So far as there is a uterus, there is hormones, it means fibroid can regrow. And that is why I tend to create these dietary approaches to reduce the hormone secretion in order to help people not regrow at a faster pace their fibroid nodules. Also, since new ones can grow the same way the first ones grew, that is the point where your surgeon may begin to ask you about or advise you about time of pregnancy, and even in some cases the mode of delivery. They may be advising you to do a cesarean section, and all these depends on how deep the surgery went on the womb as well. So these are conversations you don't just have online. You need to book with your gynecologist and then let them understand these are the plans. After watching this video, I expect you to make your own point so that when you go in front of the gynae, you'll be able to understand everything that is going on, and you can also propose some forms of ideas. In my next video, I'll be talking about a less invasive procedure. It's called UFE. Just stay tuned. Make sure you subscribe to this channel, you like the video, you share it to someone who might also be battling with fibroids.